this computer. Okay, so I'm Dr. Katy Manetta, and here today, Mr. Zach Pacha and Dr. Jon Grayson. And we had sort of thrown around different ideas for today, but I think what we have settled on is talking about a number of things related to OCD, but specifically maybe addressing this idea of why it is that logic does not apply to the treatment of OCD, or perhaps the narrow situations where we can apply logic to the treatment of OCD. So I'm going to just turn it over to you guys to get us started. Whoever would like to start, go ahead.
I don't know that it's specific to OCD. I think the rule of thumb is logic doesn't change feelings. And I can think of two. I think of a really nice, specific, simple example of why that's true, and then one that sounds reasonable, but maybe I'm making it up, but it sounds pretty good. So the real one, why logic doesn't change feelings. Being psychologists, we all know that we can put a shock electrode on somebody, ring a bell, and keep shocking them, and keep doing it until they jump when the bell goes. And we take the shock electrode off. Logic says no shock's happening. And we all know when I ring the bell, they're going to jump. They don't have any choice about that. And if it was a really super nasty shock, their response to that bell would be so aversive, they really wouldn't want to hear the bell.
Right.
So logic, no matter how logical you are, you're having an emotional response. And, I think a lot of issue in therapy is logic isn't going to make those feelings go away. So I'm kind of stuck having to cope with the feelings. So what I think if logic isn't to change feelings, it gives me a reason to go against them. If I have OCD and I've never been in treatment, and periodically I maybe have tried to fight it, and I got more anxious. So it's like, oh my God, what's happening? I can't do this. That's crazy. Oh, and then you suddenly hear, and and your family's useless. Don't do that stuff. It makes no sense. And it's like, yeah, I know that. That's why I'm crazy. You don't know what happens to me.
You should just calm down. Calm down, right?
Yeah.
Calm
Don't
down.
worry so much. Oh
don't worry about it. Yeah.
And don't think about it. Whatever you do, don't think
about it. I like that one too.
So they'd be crazy to listen to their family, but if we're convincing, it's like, oh, this will help me eventually. Oh, okay. Now I have a reason to listen. So I have one of two directions to go. Let me just go this one. No, which one? Oh my God.
Is that left or right?
It's my direction.
Okay.
I have left-right confusion,
I did not know that. I'm sorry.
Yeah. But I always know which hand is my left, so as long as I point, I'm good. I think when we think about choosing a therapy or how to do therapy, I know everyone here agrees that it's really good if I'm doing a therapy that has an empirical basis. That was, we can prove that this works, so it's not just a bunch of good sounding crap. I think though it's really nice if it sounds logical, so presenting the patient with a whole nice logical sounding system that they can get. But I don't think that's enough. I think the third ingredient is my explanation has to touch them emotionally so that they know it's true. Not that it's true, that it feels more motivating because it has truth, which is completely off the topic of why emotions. I think the trouble with logic is in a really loose way, we have these two minds. We have like this logical mind and this emotional one, and the emotional one's like a lot more primitive, evolutionarily. Imagine little dinosaurs back in the day. They don't have any cortex. They don't do any thinking. So when they see the Tyrannosaurus, it's not like they go like there's danger. They have to have an automatic response for survival, which is like, and they just run. And it's really useful. if that can be conditioned so that when they hear the, thumping of the Tyrannosaurus, they can have an automatic response. But again, it's not a logical response. It's that like, ah! And they just run right away. And I think that's such a core part of our brain that I believe, this may not be true, that we are wired to experience emotions as truth. They are reality. Our logical mind, that's like, it's logical, but it doesn't have that feeling. And, so here we are and let's face it, it's still useful to have feelings, it's like primitive man walking in a jungle, hears the noise. It might be useful to get nervous to see like what the hell is coming behind me. So here we are in a situation where, and the thing is that there are two rules that really don't work. Follow your feelings, because, we've seen so many people in therapy where that's not a good method, or just listen to your logic. It's got some pretty decent use, but there are times like that's going to not be good. This person really looks like she'd be an ideal partner for you. The fact you have no good feelings for her, we should ignore that and just marry her anyway, because she's obviously such a good match. Like, so the trouble is like, how do I know which is which? That's my starting basis.
Let's talk about like a specific OCD example.
I like Zach's response. I feel like I can read his mind, even though I can't.
Well,
I'm sorry.
Zach, were you going to say something?
I'm sorry that he can read my mind.
Oh,
It's a dark place up there.
Oh yeah.
so let's talk about a specific OCD example to sort of illustrate this. So I thought of two as you were talking, John. I thought like relationship OCD, if we want to kind of touch on that sort of logic, feeling kind of thing. You want to touch on that one and how this relates to this idea of where logic fails, and also, right, we're just listening to feelings fails too sometimes.
Am I supposed to talk now?
Or Zach can.
Okay.
Zach, what are your thoughts on it?
Whenever I have a OCD relationship case, I feel very sad. It's really profoundly sad to watch somebody who, deep down, I know I love that person, gun test,
Yeah,
but what if I don't?
right.
Yeah. So helping him walk through that journey of basically learning a new rule that, oh, I don't have to listen to my feelings all the time. And in some cases, it's a really bad idea. Some of that stuff makes sense because we learn it when we're 2, 3, 4, 18, 25, depending on who we are, 43 myself. That's helpful. But when you're trying to apply it to like a marriage or a long-term relationship, it gets a little more dicey. So there is no amount of logic that will work. They've already done the logic or lack thereof, and it's an extremely dead end. And all you get is more pain the more they try to do it. And so
true.
I think before we started, we were talking about the relief of like, oh, I no longer have to use logic. Thank God. It doesn't
Zach, I want
apply.
to take you back to something you said. For those out there who might be listening who don't know what the gun test is, I thought we would just take a minute and talk about the gun test. Now, I've heard the gun test used in a couple different ways. So one of them is this idea that with OCD, right, we experience this profound uncertainty as we approach certain triggering situations. And the gun test is, what if we had a gun to our head and we had to make a decision, right? We had to make a decision just based on our best guess of what we should do, what path we should take. So, and that is, in my mind, a way to prevent us from just engaging in compulsions, right? That could just be treading water, that could be unrelated to even unrelated to the obsessive fear. So we take our best guess and then we proceed. And that concept actually I've found works well with other anxiety disorders as well as with OCD. The other way I've heard the gun test used is this idea of there's a gun to your head. Do you have to engage in your compulsion? Right? And if you get the answer wrong, you're dead in either of these situations. So high stakes game. Jon, tell me, did I do a good job of explaining your gun test?
Oh, wait, I get to be the judge? That's
Yes.
Horrible. You know, the one thing
That was
That
off
is
the cuff.
horrible.
I'm not reading from notes. Come on.
Often I've switched from shooting the person to their child.
That's
Oh.
why
Sometimes
I
they're
have
just-
two guns.
Yeah,
I've done
sometimes they're
that
too
too.
sometimes they're too willing to like die. So it's like,
I know.
but having their kids shot
Or
in the
with
back of the head.
children, we don't really use the gun test. I have to tell you, in my practice, we use win $1 million. Sometimes, like you win $1 million if you get it right, you get nothing if you get it wrong.
That's a good idea, Katie.
Yeah,
I don't
I
work
you
with
have
a
don't
lot
want
of
I have a
kids.
children
variation of that for teaching therapists how I think there are a lot of therapists who don't seriously take how much at risk it feels like for the person suffering from OCD. Because whenever I'm doing exposure, which partially goes back to the logic question, so I'm almost on topic. Why would you take this risk?
Mm.
That's the question, to do this. And I think too many therapists, it's like, well, so the question I will ask them, imagine I have a gun with 100 chambers. 99 chambers have $50 million, and one chamber has a bullet. Will you stand behind your kid and pull the trigger? So, right, most people say no. So it's like, all right. Actually, I think I start with 1,000 chamber gun just to make it shorter. All right, so we're going to have 10,000 chambers, 999 chances, 9,199 chances to win 50 mil, one chance to blow
Notice
your
we
kid
didn't correct
away.
you.
That's
Yeah,
right.
I know. To blow your, yeah, I thought that was fake me. Or, one chance you're going to, blow your kid's brains out. Will you pull the trigger? No. All right. 100,000 chamber gun. 999,909 chances for 50 mil, one chance to kill your kid. And it is highly likely that at this point in time, there are times you put your kid at that level of risk to die. Will you pull the trigger? And the answer is no.
No.
And the lesson is that's what you're asking the person with OCD to do.
Right.
And I had one therapist that was great. He said, God, well, there's no reason for them to do treatment. And I said, well, the difference is you have no reason to pull that trigger. They have a horrible life that's really going terrible, and their worst fear might happen anyway. So in a sense, logic in that case, we're never using for changing feelings. We're building a case of like, why will you take this risk? And I think when bringing up relationship OCD, I think there are two issues. One issue where education matters is some people's idea of loving someone is overly perfect in Hollywood. That is, I have to have constant, never-ending, orgasmic feelings of love for them every moment, and I cannot find anybody else attractive or imagine being with anybody else. And there can be nothing I see wrong about them.
I love it that you're both from California talking about this.
I feel like I have an edge being, on the East Coast till I was,
Right.
in my 60s.
The bi-coastal perspective.
The best, yes, yeah, I'm bi, but the best of both worlds, right? So, so first we have to get them over like this rigid level of thinking.
Mm-hmm.
And I have to point out to them that, like, no matter how good your spouse looks now, in 40 years, they're not going to look as good as they do now. So looks wise, in 40 years, you're going to be settling for second best.
Unless you are in Southern California. I just want to add that.
The important distinction.
Important distinction. But yeah, that's
Botox,
true.
Botox and liposuction. You
That's
can't
right.
beat it.
That's right.
Okay, so time out though. Here's something I just thought about. What you said is factually accurate.
Right?
Yeah. Yeah.
Isn't that logic?
Oh, but it doesn't change feelings.
Aha, good
It's
point.
giving me a reason to go against feelings. You're going to come to this anyway. Like, and I think with the so I first want to get into your definition of love. If that is the true definition, everybody's screwed. But
Yeah.
in a way, that's okay because, okay, I'm asking you to do this terrible thing, settle for second best. Remember, I think we talked about this last time we saw it. Acceptance sucks.
Yeah.
I'm deciding to live in a world that does not meet the ideal I have. And one major reason to do it is the ideal is not possible. Now, for this individual, the only question is, are you ready to leave them today?
Hmm.
Are you ready to leave this person today? And not because it's so much suffering from the anxiety. It can't be to escape the anxiety. Are you ready to leave them today? And if the answer is no, it's like, well, okay, well, here's the plan. Until you can go for like 3 weeks straight, knowing you want to leave them, you have to stay. And by the way, wondering if you're in that state is already wondering, so that doesn't count. It's got to be, holy crap, get me the hell out of here. I'm done.
Right.
Otherwise, we're
Mhm.
asking you to stay and second best. And so I think there are a bunch of things that are going to be treatment specific. So on one hand, we're asking them, yep, you don't get to know. Logic is not going to tell you whether you love them or not. And your feelings, any feeling I look at that way is like if I have to feel love a certain way, I'm likely to interfere with it. I can't do my sexual arousal because if I'm looking at myself to see if I'm aroused enough by you, that's going to interfere with my arousal. So I don't know if that did. And if I look at someone else and find them arousing, I think the name we have that, I think in the professional world, we call that normal. So there's no way that I can measure my feelings and use them as a logical measure, which is a fascinating thing about OCD. They're trying to fix feelings with logic,
Right.
and it also doesn't work.
Right.
So it's kind of like, now the one thing that, I mean, there are a couple of tricks. I've asked people, I want you for this weekend to notice anything positive about your partner. Anything, not anything, any good feeling you have. I don't mean feeling it the way you should.
Hmm.
I just want you to notice any little positive feeling. I want you to notice any little time like you're having fun with them. Because even if you don't love them, you might be having fun with them. So I just want you to notice that and report back. Because the idea being they're so focused constantly on, do I love them? Do I love them? And is this good enough? Am I feeling the way I should? That they don't even notice if they're having good feelings. Now, this doesn't prove they love them. This is just learning, like, as long as you're going to settle for second best, let's teach you how to enjoy it more.
Right.
I had somebody who had a different problem, a hyper awareness issue where they said it ruined everything. And I asked them to watch a movie and tell me any part of the movie they enjoyed, no matter how little. And next session, they were like, it all sucked. It didn't work. I was just thinking about it all the time. Oh, okay. So tell me about the movie. So he starts telling me about the movie, and it is clear that this person enjoyed the climax of the movie. It's a war movie. He's a guy, war movie. He thought it was a cool climax. So then I kind of go in the lawyer route, ask him to tell me about this climax. And it's like, wow, that's pretty cool. Yeah, it was. Like, like you're glad you saw that. Yeah. You didn't do my assignment. You clearly enjoyed part of the movie. Maybe not as much as you should have, but you
Right.
enjoyed it. And the role, it was like, even as 5% tell me. And this is critical because your memory of this movie was essentially a false memory that the entire 2 hours sucked. The reality is it might have sucked a lot, but there was part of it you liked. And in terms of learning to be mindful, these would have been little places, little islands that we want to grow,
Right.
you know. So that's one little assignment, I might give the person, again, not to make them love them, but to, get used to it. To learn to live with second best. And I never get to know, if it's enough. I mean, it's this feeling like my true love's out there, I'm going to miss them. Yeah, but this individual might be your true love too.
Right.
Or more likely, you're going to do this with everyone.
And so there, you're touching on this important sort of clinical point that we were discussing before we started.
I'm so glad I'm doing something right.
You are wonderful. You're weaving right into what we had planned for today. It's wonderful. But in the situation we were talking about with relationship OCD, right? The fear is always this what if, right? What if I dedicate myself to this person, get married, and in 20 years I find out this is not the right person for me? What if in 10 years I find out that there was somebody out there that I was meant to be with, and I've wasted my time, wasted this other person's time?
Oh, wait, I'd have trouble with that one.
Hmm.
Why would you have trouble with that? What I'm talking about is
I have such trouble with that.
Why?
Well, two reasons. One, I'm a pain in the ass. But then the other, but the
This is well documented.
The clinically interesting reason. I always argue against anybody who's worried about regretting a decision. For this reason, when I compare the current crappy situation to what it could have been if I made decision A, I'm cheating. I'm comparing my current situation to the other one if it worked out perfectly.
Right.
So if I made a different decision, I'm fully agreeing things would have been different. And better is one of the options.
Right.
But so is worse.
Yes.
I always imagine a woman coming out of a 5-year horrible abusive relationship where every other week she had the hell beaten out of her. And she's in therapy and she's like, maybe a month in therapy, she's like, Jon, I think a month or so in this relationship, I saw this coming. I wish I had left back then. And I would say, no, you don't. And having gone through 5 years of hell, she kind of looked at me and said, well, here's the thing. 5 years ago, you were the kind of person who would stay in this relationship. So what makes you think you would not have found somebody worse?
Right.
Better is a definitely possibility, but so is the other.
Right.
So when I think about successful decisions, success is not making the right decision.
No.
Success is coping with what consequences of whatever decision I've made. It's always moving forward. So if I discover, holy crap, for 15 years, I fooled myself into loving this person. I don't know how I could be so blind to realize that they are like a complete nightmare for me. And thank God Susie Q is available because she's the one for me. Well, then I have to move forward and go after Susie Q. It's like, all right, you're going to get divorced. Because I mean, some people with the relationship OCD, right? That's their feel like, well, what if it ends later? And it's like, well, you might actually decide within the year that you're madly in love with them and do want them forever and you're really comfortable. And the next year they decide they want to divorce you.
That's right.
Or the really weird situation, which for some reason is always semi-okay with the people, even though they wouldn't want it to happen, which is if the person drops dead, that's okay. I didn't do anything wrong, so it's not my fault.
Because it wasn't within their control.
It wasn't in my control.
Right.
Jon,
I want to take us back though to the point that I was making because this is
did I go off subject? Go on.
You went a little off topic from where I was going, at least. So this idea that in all of these scenarios, in all of these what if scenarios that people throw out there, that people with OCD ruminate on, like what if this is the wrong person? What if there's someone better out there for me? Is idea that
there's
treatment that there's the treatment that we have to do is to accept and embrace the uncertainty that goes with any of these possible futures, right? because there can be no certainty. We have to make a good guess and then
We have
just
to make a
proceed.
guess.
We have, exactly, we have to make a guess and we have to proceed. We can't know, even the people, and I have patients who say this to me, that they'll say, well, I feel like when I look at these friends of mine, right? Oh, they're so in love, they're so smitten with each other. And that's an example of, right, that they are certain. And so I should be able to be just as certain as they are. They're not certain. They're not certain. They're not certain even when they're walking down the aisle. They might tell themselves they are.
Yeah, well, I mean, I think since we're all smart people here, you'll agree with me. I think the only people who are certain are stupid. Think
John,
Trumpers.
I think that's actually become a meme now, you saying that.
Oh God, I hope so.
It's pretty good. It's pretty
Yeah,
spot on.
yeah. It's, I mean, yeah, I think all we have for everything are the odds.
Yeah.
And there are times we can identify incredibly low odds.
Mhm.
Like it seems like low odds that I have to worry about airplane parts falling from the sky hitting me in the head. When my son was 10, there was a school nearby where a helicopter crashed into a small plane and it rained down parts on the school playground during recess. Kids died.
Oof.
What are the
Jesus.
odds of all that happening? Small crash over a schoolyard at recess.
Incredibly low
Low
probability.
probability events happen. However,
But could it? Yeah, it could.
all we're stuck with is like, I have to live with that because I have no control. So the best I can do, and I think I think living with uncertainty translates to no matter what the worst is, I hope that I will try to find a way to cope with it.
Yes.
I mean, it might be catastrophic for a while, I mean, so it might take me a year or two to recover from a horrible loss. But, I don't know that I am so great that I could cope with anything. But I know that for almost every horrible, extraordinary situation we can find, there are people who have coped amazingly well. So that tells me that it's possible. So I don't know that I can be as good as them, but at least gives me a reason and something to hope that I can do. And if somebody were to say to me, well, what if you can't? I think the answer is, well, I mean, I have two answers. I treat it like the car crash I might have later today. I'm going to deal with it then, not now.
Mhm.
And the other alternative is, if that happens and I truly can never find a way to cope with it, I'm screwed.
Sure.
But that's only one possibility out of many. So I'm going to wait till I get there.
Right.
But wait, you can still go back and say, well, then I'm going to try to be the best version of screwed I can be.
Right. I hope.
Yeah, I hope.
I do believe with a high degree of probability that if I get blinded, I believe I'm going to have a really long period of panic attacks over that. I feel like that would really, and I feel like I'd have them at a level of like times like, oh God, kill me. So I feel like that would be really, that particular one would really get to me.
Mhm.
So anyway, I hope I'd eventually cope. It would be sad not playing video games anymore.
I hear this a lot for folks that
Well,
don't play
yeah.
video games anymore. Yes, that would be
But I listen to a lot of audiobooks, so I'm already halfway there for that. Yeah, go on.
Oh,
What were you gonna
good.
say?
What I was going to say is that we hear, I hear this a lot with folks that, are afraid of causing the death of their child or just that their child's going to die. And I remember one time there was this dad who had said, that he had this idea of like receiving a death notification, right, from the police. And so he was very vigilant and texting his daughter, et cetera. And he just sort of envisioned himself collapsing, right? And so all of his hypervigilance was surrounding this idea that somehow he could prevent this outcome from happening. And the truth is that he can't prevent that outcome from happening. And so we had to think through, what if that did happen? What would you do after you collapsed?
And
Right?
what you did is that's so brilliant.
Well, thank you.
is that most people, when you ask, what do you do if your
True
kid
story.
will die? Their answer is like, yeah, I'm not thinking about it.
Right.
So everybody kind of stops at the, I'm looking over here because I'm going to pull something up maybe. Everybody stops at the point of getting the horrible phone call.
Because they don't want to think about it, because it's
Right.
too
And you
horrible
went
to
through
think
the whole
about.
thing, and not that it made it acceptable,
No.
but it suddenly made it, there's a way. You remind
And
me
we
when a
have to
kid,
think about it. When we're avoiding thinking about it, that's where we really get into trouble with a lot of
Yeah.
compulsions and anxiety. If we think it through, it loses, particularly if we think
well,
it
it
through on
becomes like,
repeat.
this would be a second best. I have to, I'll cope with it because I don't have a choice. When
Exactly.
my son was about 16, and he would always come in late from curfew, and Kathy
Mhm.
would always want to call him. And I didn't let, I didn't let, I would always argue with her not to call him, not to be nice to him. But I knew, she kind of knew, but his cell phone was always off. So it's like, if you're freaked out about your kid and you call him and he's not answering, this is not working.
No.
So she would kind of like, well, when can I call? And I'd make a calculation. He's supposed to be home here. I think he'll be home by then. And let me add like another 40 minutes. So I'd say like this time, and she, for some reason, because this seems out of character for her, she'd be fine and go to sleep. Then I'd sit there and I think, probably he's not doing anything horrible, and probably nothing horrible is happening to him. But this could be the night where our lives change and everything goes to hell. And then I'd go to sleep.
That's good. Just leave your wife with that and off you go to bed.
Well, no, she'd be asleep. I already calmed her down because
Oh, okay,
she's
good.
waiting for 2 in the morning, you know. So,
Okay.
you know, and apparently I was statistically pretty good because I always guessed right.
Yeah.
You know, now I had this, and I may have talked about this before. I had this young woman who I'm allowed to talk about came to me around 17, who was a complete mess, came out of the hospital, couldn't tolerate sitting in the counselor's office at school for an hour. Her anxiety was so hard. Her meds were a mess. She had had a serious suicide attempt. And over the next 3 months, she did pretty well. Like, we got her meds under order. She started getting better. She wanted to be in my support group. And I said, well, it's really for adults. But they said, we think she can handle it. Whenever she would speak in support group, she would be so brilliant that no one could believe she was 17. I mean, she didn't look old, but it was like, this could not be a 17-year-old. And over the next 6 months, and considering where she started from, she did amazingly well. Like, we were already tapering off treatment. And the last time I saw her, her parents were taking her and her 14-year-old brother out to Joshua Tree. For those not on the East, you know, West Coast, it's in the desert where some people like go for vacation home, to get a vacation home. And on their way out to the desert, a woman on her third DUI rammed the car and killed both kids.
No matter how many times I hear you tell this story, it still hits me, man.
Yeah,
I love
you
this
know, the
story.
parents were devastated, and it was really hard. You know, I mean, when they came to treatment, and they were incredible. But it's like, well, we don't really just want to be the parents of dead kids, even though that's all we can imagine.
Right.
And you know, and you have to, you can't say anything that's really consoling to somebody like that. So you have to find, what am I going to say that's useful? It's kind of like some kind of truth that's not going to make things worse. But, you know,
Yeah.
and I said, well, I can tell you how therapy will go if it works, but I think it'll just be words right now. And they're like, yeah, we think it's going to be words too. But it just seems like it's nice to know there's some possibility. I said, this year's going to be horrible. Much of the year is going to be spent comparing every moment to what it should be if your kids were here. And if, you know, we're doing well by the end of the year, there will still be a hole in your hearts. You will still cry and miss them. But you will also be able to enjoy life in the present and not wish they were there. Dad, they took that in. Dad wrote a book about grief where he wrote about that session. So I got to read his response to the session, which was, when the therapist told me that, I thought, F him, I'm never going to stop wishing my kids were alive. And then he went on to say, but now 2 years later, I realize it doesn't do me or them any good to keep wishing they're alive. So, right, I think if we're scared of something, we don't really have a choice but to think about it. I think denial works at a certain level for lots of people, but depending on what it is, denial falls apart. Like in the pandemic, we saw denial all over the place. When people say, like, I can't live like this all summer. I kind of thought that, right. Now everybody laughs at it because it's like, but then they kind of meant it's like, really? So what's the alternative reality you're going to?
Right.
You don't really have much of a choice. So yeah, I think everything is odds. Or this doesn't work today because we're doing this, but sometimes when I'm giving a talk on this subject about uncertainty, I'll say, imagine we could be living in a world where everything's kind of going along kind of okay. And then suddenly, like a worldwide pandemic comes along and messes everything up. That can't happen.
No. Low probability, right? There's
It's a low probability. So,
right.
So I'm in complete agreement with you, Katy.
I don't even remember what I said now. Just joking. No,
yeah. We're stuck learning to live with odds.
Right.
And it can be really upsetting.
Right. And not seeking certainty, not trying to find certainty, because it's funny when I'm working with folks and they say, that when they approach a certain exposure situation, that they start to feel tremendous anxiety, right? And they start going through their mind and trying to find ways to reassure themselves and find that certainty. And it's like, that's your OCD, right? There's your OCD at work right there, not allowing you to embrace the uncertainty and step forward. And it's difficult because our bodies, like you said, our bodies react. Even if the shock isn't there, our bodies react.
Right. And I think we're wired to dislike uncertainty.
Yes. Oh, certainly. Yes.
So we have to fight against primitive programming.
That's true.
So
what about these folks that say, oh, go ahead, Zach. What were you gonna say?
Yeah, I was thinking about something just within how you described the person you were working with, and you're like, and then what? And then what?
Mm-hmm.
I think one technique we use, we listen to the actual literal language that people say. So many people take it as semantics. No, listen to the literal words they're saying, and that is the gold they give you for figuring out how to do exposures.
It's true.
Yeah,
I agree. And that downward arrow technique, right? Of, well, and then what happens? And then what happens? And John's right. So often when folks come into us at first, they're so anxious that they say, well, I can't even think about that.
Yeah.
I'm not even going to think about that. Why are you making me think about that? I've had a lot of angry reactions when I encourage people to think about those things, but it's important that we figure out what's at the end, right? That we get people to start considering that.
And it's important not to go too far.
Oh, talk about
what do you mean by that? Yes. It was a setup. Well, because with downward arrow, I want to find out what's like essentially the bottom line fear.
Yeah.
But there are some logic-based cognitive therapists who they want to go to the point of like, what's the worst fear that's not so bad? Boy, you want to piss someone off. Like again, with
give me an example. I think I get what you're talking about.
With hyper-awareness, where the entire problem is I don't want this thought forever, even though it's a neutral. I don't want to keep remembering that picture, and it's in my mind forever. You don't know what it's like. And so there's an equation that makes life hard. It's a form of OCD in which the feared consequence comes true. As long as I have this thought, life is miserable, and because I've made that equation, it's true. So the therapist will go like, well, what's going to happen if it's there? You're going to lose your job. And they'll go through all these things. And it's like, no, it's just that it's there. So they just piss the person off because they're trying to demonstrate it's not really so bad. It's just, it's stupid thought. Whereas what I have to accept is, okay, this is the place I'm working with. This is the disaster. I don't need to go beyond this. I mean, sometimes women will have like harm thoughts, but the harm thoughts don't actually go to slicing and dicing their spouse and making a teepee out of their
Right.
skin. Sometimes it's just
And sometimes it's just the discomfort of the experience, right? Sometimes that's
Yeah.
as far as it goes, right? That if I have to experience this, I will feel incredibly uncomfortable.
by the way, a side question, maybe.
Hmm.
Are we making this for sufferers, professionals, or both?
I think it's both. I mean,
Okay.
people who
Why?
there's so many therapists out there who don't treat
Okay,
OCD.
but
and
but
they
I, but I,
haven't
no,
had
I
any
want to
training
I
in
want to
it.
make a point that's not
Okay.
obvious.
Mm,
Clearly, I say things that are outrageous, and so there's a thought of like, that's me, which is true, but actually, it's also planned. That when I say, for harm OCD, well, I don't know if I'm not going to slice and dice my wife. I am purposely using something that's off, kind of humorous, but really dark,
hyperbole, yes.
to actually put a distance there so they can listen.
Yeah.
As opposed to, let's face it, I could say, well, I might, and then go into a really wonderful graphic dismembering my wife in detail with blood and guts. That would be just horrifying. That'd be fun to put in a novel. But
Hmm.
but in the purposes of this, I say things, and so it's not just that I'm like, oh, I'm just wild and unpredictable. Those are actually planned ways of saying things to draw their attention, throw them off, but not in a ultra negative way, and get them to experience in a slightly different way so they can listen to it. If I was thinking acting going into their jargon, I'm I'm
I'm
I'm
with you.
subtly I'm doing diffusion without
Yep.
talking about it.
Right.
I'm helping separate the thoughts from the feelings without doing it. Because again, in a logical way, that's a kind of useful concept, but I don't necessarily think it's not always useful to describe, because again, if I say that to a client, for certain OC clients, that would become so much the goal, they'll interfere with it by waiting for the feeling of the feeling of diffusion, that magic moment when it's just the
Right.
thought.
Right.
So they constantly measure, like, it's not there yet, it's not there yet. So that may be my goal, but it's not useful. So I'm not doing diffusion in the big sense, because I think ACT is a kind of overall system, but I always think like I need to apply it in a micro way with OCD as opposed to macro way. And I don't do the macro way because I feel like an alcoholic can have a lot of problems, but I have to have them sober first. So I think it's similar with OCD. If I'm lost in my OCD, I got to get some control over OCD before I could talk about the larger values of ACT and have them understand them. So I'm using those principles, but somebody with ACT would accuse me correctly of like, you're just doing it in a smaller way. And it's like, yeah, there's an empirical question of what is better way to approach the problems. And we haven't done this study yet, which in a sense follows along with an ACT principle of like, here are two different ways to do it. We don't know which is the right one. It's a theoretical, empirical question. So anyway, I just wanted to point out that because pretty much anything I say in here, I don't always make a TP out of her skin. I
That
just
is
throw
a new one.
slice and
That's why I was
dice.
laughing.
Oh, it's not really.
It's just I haven't heard you say it before.
Yes. I'm protecting the identity of the person who said that to me.
Oh, okay.
But slice and I think I'll take credit for slice and dice.
I
Um,
I could tell you, I heard you say that at IOCDF one year to a person in the audience that was a sufferer that was
Oh
getting a
no.
question. But I mean, it was totally relevant. Because you were explaining, uncertainty and about, well, as of right now, I have no plans, but if I fly back to LA and
You
then I
never
slice
know.
and dice my, Kathy tonight, so be it. That's where I'll deal with it. And it was like, that's just
because I don't
the
have a
suave way that you
choice.
do it.
I can't
You know,
make sure
on a
I'm not
much
going nuts.
less dramatic scale, I often use my own relationship with my husband, right? So when I have a relationship OCD client, I will often say, do I know that I'm meant to be with my husband, that we're soulmates, that we should be together for? No, I don't know that, my poor husband, right? But you know, it's important to point out that even people that have been married a long time, if they're really being honest with themselves, they don't have 100% certainty on things.
I like to say, I feel like I love my wife.
Yep.
And so,
Hmm.
I feel like it. But if you're going to ask me, do I know it? Because I mean, can I know it? And so all I can do is like, okay, we've been together 50 years. There's nothing overtly, obviously pathological about the relationship. We're not killing each other or doing anything. And she has ultra negative feelings. She's done such a good hiding, she's hid them for 50 years. So it seems like it's going pretty well. I don't lose anything by treating this as a fact.
That's right.
So I might be wrong, but I'm okay with it.
That's right. You're
Like,
rolling, you're
like,
rolling
like,
the dice and you're gonna stay
well,
in
There's
it's
the
like, it's like, it's
probability.
like, it's like, it feels good enough right now. It feels true. So I'm going with it,
Mhm.
and what if I wake up tomorrow and I also point out to people, when they were, the people, it's like, well, what if, you're going to stay with this person and they might be second best. That's it. Like, and there, and plenty of people will make that second best choice on purpose. Like, I'm not so crazy about my spouse, but I don't want to leave because of the kids.
Right.
Or if we think the person is you'll love this, a like, morally good person in love with their spouse, who then is in an accident is a quadriplegic.
Hmm.
Generally the idea that I'm going to leave seems really bad and horrible. We would understand the feelings, but they're supposed to like stay.
But
And
is it my
even
dream
more so, and even more,
relationship?
and
No, but
even
would it
and
be a
even
dream?
more, yeah, and even more so, like we don't have to make the individual quadriplegic. How about just, you know, crippled and messed up, and there's a lot of things, but we can even let them be mentally there. But yeah, I'm just making it like the guilt
Mhm.
for leaving would be so much worse.
Right,
But in terms of what I dreamed of for my life, this is second best.
right,
And I might actually care so much about the person, which might be different than loving them, that I'll choose to stay anyway.
right.
And do I really want to do that? Well, you know what? Actually, it'd be kind of pretty normal to like, no, I really wish I didn't have to do this, but I'm going to choose to do it.
That's right.
So I can make choices and not be absolutely sure. Well, again, I don't know how to be sure. I always tell people, if they know a way to be certain, ICBT doesn't fall into that category. If they know, oh, I shouldn't have done that. If they know a way to be certain, I will pay them. There's only two things they have to do. They have to know a way to be certain, and then the really difficult criteria. They have to be able to convince me they know it.
That's right.
They can pull that off. I'm in. I think. I don't know if for real. I don't know if I care enough about being certain that I'd be motivated to do it.
I know.
It's like, oh, all right, I'd be so like, what do I need to know that? I can't think of anything I need to know that much.
But
I
that is
mean, I
Me
get.
right, the
either.
I mean,
nature
am
of
do
OCD,
I need to
right?
know I'm healthy and I'm not like sick and maybe going to die in a year? Like, I, I mean, I guess it'd be nice to know if I'm sick so I could get help. If it's
Be
preventable, I
nice
could
to
get some
know, right?
pre-treatment. But what if it's just like, well, you're kind of messed up. This is something we have to watch, and we hope. Well, I mean, a lot people walk around with heart conditions. It's like you're taking these meds. We're trying to do all this thing to raise the odds you're going to live, but you are at greater risk.
Right,
So I don't
Right.
know. So what do I need to know? Well, you're not at risk for the next 6 months. Well, then you're dead. I don't know what it is I need to be certain about.
right.
I have a former client that they got news that their cancer returned, and they were in their mid 40s when this happened. And they purposefully they were like, okay, here's what we're gonna do for the treatment. We'll monitor it, whatever. And they were like, I don't want status updates of like how long I'm gonna live. says it's just gonna make it worse, I think. It'll affect my quality of life. I was
Mhm.
like, you are brilliant. You have learned something in therapy about uncertainty.
Mhm.
And this was
Yeah.
somebody with
That's a
OCD.
superpower,
Wow, that would be
yeah,
hard.
right?
They become the person you hope to imitate if you're screwed.
That's right.
Amen.
Somebody that really can embrace uncertainty like that. It's amazing. So what of this notion that that when you're treating OCD, should I say it that we don't have to find certain that we can find certainty, or we can help our clients find some modicum of certainty that will circumvent the need to embrace uncertainty.
Yes. And then going back to the initial question about logic, we use
Mhm.
tons of logic, but all in the service of, well, your rituals don't work. I can prove how you're not doing your rituals enough. We have these two life paths for you. The life of hell you're following. You've done an incredible empirical study of trying that method. It's like, seems the results are pretty clear.
Mhm.
Or you can try to work and learn on the stuff we're saying. Because your method, not only is life horrible, but like the best stuff might happen anyway. So in that gun with the 100,000 chambers, yeah, you might get the bullet, but at least you're going to have a good life till you hit it. And we're suggesting you get the 50 mil by listening to us, probably. The other way, you definitely aren't getting it, and life's going to suck. And so,
And you can still get the bullet.
That's right.
exactly. It
And I
reminds
think
me in my Bible,
I like
catch.
this version. I haven't heard you say this version. I like this version.
I had to come up with that because, I think whenever we're working and supervising therapists, I mean, the two, one mistake that constantly happens is they just jump into doing treatment and they're having trouble. And it's like, oh, wait, you haven't actually gotten them to agree that they want to go for this uncertainty yet. And that's why, like that's why you're hitting a wall. But then the other one is this insensitivity to, this is a serious risk for them.
Yeah.
You know, um, it impresses me in our field how few people actually have empathy. No, I'm dead serious. Sympathy,
I
therapists are great at sympathy, as is everyone, but empathy means like, you tell me your problem, and I have to try to imagine what it's like to live with those, like that's the rules, what it's like to
with
live
those
with those
parameters,
rules,
yeah,
as
yes.
opposed to, well, I wouldn't do that. Oh,
yeah.
that's the problem. No, I wouldn't do that. It's got to be like, what is life like that way? And can I get into it deep enough so that I can then maybe see a way out, but also get into it deep enough so that I can get my favorite compliment from clients is, which is when they say, do you have OCD? Because, if they say that, it's like, okay, I've done good at like understanding and having and communicate my understanding. And I don't think most therapists do that. When I was supervising therapists, I would always ask them, and we'd do a session where I would ask them to imagine being raped, which I got incredible resistance to. And I would always, they say like, why do we have to do that? And it's like, well, you're going to be talking to somebody who actually went through this. I don't know. Isn't it kind of the least you can do to try to understand what they went through? And then I would also have this little thing I wrote about it that kind of describes it from the point of view of the person it's happening to, in case they didn't think of some things. But it's like there's a kind of a resistance at times to even think about, what would it really be like? So anyway, that's where it came from. I sit and obsess like, what would be a good metaphor to try to, get them to do that? And that most people aren't going to shoot their kid in the back of the head without the kid knowing.
No.
They were sometimes willing to shoot their spouse if they could ask their spouse's permission.
John,
Hey,
I love
honey,
it that you've
honey.
you've inquired about various permutations of this
Well,
shooting.
no,
of
people will
in the
ask you,
head.
well, if they don't have a kid,
Yeah,
Yeah.
and
we
they'll say
gotta
like,
find something,
yeah,
right?
can I tell her, or can I tell them? It's like, no, you just have to stand up without them knowing, you know.
I love it when people have, OCD harm,
He's a
but it's like,
therapist, remember?
but it doesn't apply to my spouse. Whatever. Doesn't apply to
Yeah.
my spouse.
They're
Kids,
so worried
absolutely.
about their
Spouse
children, right?
or their dog. My
Strangers.
dog,
Right?
absolutely.
Oh my gosh,
Spouse, they're fine.
that's so funny. Isn't that the truth?
True. Yeah.
So we're coming up on the end of our time. It's just really flown by.
Yes.
So does
When we
anybody
get
have any
three
good-
people that have our experience level, and we're, I think you'll consider this a compliment. We're all kind of nerds about it.
Yeah,
It's easy to just talk about it for an hour.
And I feel like that was such a generous way to describe us because, I might have said, we get three people who can't shut up. But I like your view. I'm not sure they both might be right, but in a kind of self-serving way, I'm going with you.
Okay, that sounds good.
Well, so what I was going to ask for was some sort of either summative points or last perspectives, and I'll just throw mine out there just for what it's worth, is that, and this really this experience with you guys really just highlights this, is, the part of the reason why I do OCD treatment is because it's so enjoyable as a therapist. I mean, it's really just a rewarding experience as a therapist. And I just can't, it's hard to imagine anything else that's just as exciting as being able to connect with a client at this level. And, those first moments that we have when we're educating somebody on what they're, and I always say, oh, it's so exciting, a fresh OCD case, right? Somebody who's never been educated on this, and being able to walk them through those first pieces of education on this, and watching it sort of dawn on them, right? That there's this other way of looking at what they've been doing. And I think it's remarkable, and right, why we all do what we do.
I have to agree with that because, I think OCD is an incredibly philosophical disorder, right? Because they're all the what is are the questions of great, like, what's the meaning of life? How do I live in a life where anything can happen? What's the nature of God? Who am I? Is reality real? And I feel like the only difference between someone with OCD and a great philosopher is they actually want an answer. Somewhere there's a college professor who spends his entire career studying the work of a single philosopher because his answers to the meaning of life are so complex it takes a lifetime to attempt to understand them.
Right.
And so I am kind of logical, and I really love the logic of, I can't make somebody feel comfortable using logic, but I can use logic to destroy the OCD schism enough that there's nothing left but to attempt to learn to live with uncertainty.
Mm-hmm.
Because I think for every form of OCD, there's like an entire set of arguments that are all still focused on this doesn't work, but that form. So I like enjoy that part of working with OCD, and I've said this before, but remember, I have a limited repertoire. It's good, but it is limited. People who have OCD, when they recover, they are not normal. They are better than normal because the average person doesn't cope that well with uncertainty. And so it's kind of satisfying to help people do that.
Dak, any last words? Famous last words?
Nothing as brilliant as you two will say, but just
That'll teach you to
echoing.
go first.
I know, right? I'm like both of you in that I can't get enough. I don't see myself ever getting tired of working with folks with OCD. no person's the same, no case is the same, no matter what they're dealing with regarding OCD. And just seeing the progress that they make from beginning, middle to end, and having a hand in that, it's really special. And it's a pretty small community.
Yeah.
I
And-
mean,
and- yeah.
I was looking on the IOCDF directory just to see other providers in my state.
Yeah.
I was one of 3 at one point, and now we have 15 in the span of like 8-9 years.
John,
Where
we
are
have
you
a
in
few
Iowa?
more. We have a few
I'm
more.
in Des Moines.
Des Moines, okay. I wasn't sure it was that or Iowa City. Okay.
Yeah,
John,
no,
we have a few more here in Southern California, just a couple more, but
right?
But
But it is
the list of how many I trust is small.
I know, I
You
agree.
know,
That's another good point.
there's there's like about 3 people I trust majorly, and then there's like 2 others, but so I think and just speaking in terms of you don't see getting tired of it. For whatever reason, I've been doing this only since 1978.
Hey, I wasn't born yet.
Yeah, I know. And I sometimes
No
wonder,
comment.
is something wrong with me that I still enjoy doing it? But I have an answer to that uncertainty.
Hmm.
I don't really care. I'm having fun, so I'm gonna have to wait for it to hit me in the face of why it's a problem.
Yeah,
Right.
So I'm that's the plan.
wonderful.
That's awesome.
Oh, guys, thank you
Thank
so
you.
much for today. It was absolutely fantastic. We'll figure out how we're